About 734,000 people living with or affected by HIV have benefited from orphans and vulnerable children interventions across 19 states in Nigeria through the CDC Orphan and Vulnerable Children Program tagged OVC. The above was the highlight of discussions in another session of U.S. Center for Disease Control and Prevention Media Roundtable, which held in Abuja. Let's now join our health correspondent Elizabeth Kasham for more details.
The session, which highlights on the importance of orphans and vulnerable children's program in Nigeria and how the US CDC are working collaboratively to empower people who are affected by the HIV epidemic, centered on interventions that seek to improve the overall well-being and alleviate the impact of HIV on children and affected families. In an interesting presentation, the OVC program specialist CDC Nigeria, Dr. Olufemi Oke, said the US CDC Orphans and Vulnerable Children's Program utilize a case management approach which involves working in partnership with children and families to identify their needs, plan, and bring to completion a series of actions via specific household goals.
The VSLA has also helped them to diversify their business. Recall, I said that some of them do not share their profit. They diversify and invest it into other business. Somebody said, when you are engaged in communal business, it's not likely to run down because everybody is looking at it. It's not your own business, so you can't run it your way. Every member of the VSLA wants the success.
Government and non-governmental programs said they are working to complement the efforts of the CDC in Nigeria to mitigate the burden on the nation's 25% vulnerable children and their caregivers, including families affected.
The government of Nigeria is currently planning another survey to determine the burden of OVC in Nigeria this year, 2024. We want to place on record the support of our donor CDC for the VC response in Nigeria. The Vulnerable Children Program approach is child-focused and family-centered, community involvement, partnership with civil society organization, and capacity building efforts to ensure that OVC is cared for and protected by households in communities, local and state government. The government of Nigeria.
We are sure, we are confident of our operation, of our activities, that we have the capacity to watch and to coordinate every program, meaningful programs, to the grassroots.
Meeting recounted their successes, which they said brought about transformation and economic stability in their homes.
A lot of changes in my life and my family. When my son finished secondary school last year, is going to just as well September last year, I lost my mother-in-law. I cannot tell my husband that how are we going to do about my son's admission. I have to run to the village meeting to give me loan. They borrow me the loan. I join to the ward I have to register myself for Gudua Secondary School. Not only that, the money that we are giving out as a loan, we did not spend the money. We did not keep the whole money. We use it to support our family by buying rice.
Okay, I was doing a charcoal business only. So when I joined the association, when we share the profit of our vegetable farm, I still add up value to my business because sometimes before the month end, before my husband will collect salary, like going through some difficulties. So I now add up my business.
The Strengthening Program is a portfolio of interventions delivered to reduce the economic hardship of families and empower them to provide for the essential needs of children they care for, rather than relying on external support. The interventions include improving household resilience and financial assets among vulnerable households, funded orphans and vulnerable children's program, households economic strengthening interventions like village savings and loans association, among others. Elizabeth Kasham, ASU Television News.